Thanks for joining us. I'm Helen Jung. I'm the Oregonian's opinion editor, and I am the editorial board is meeting with the Republican candidates for the second congressional district. On the editorial board, actually, if we can go around by first introducing ourselves, and we'll start with John.
I'm John Malheur. I'm president of the Oregonian Media Group.
Grace Bottomley, editor.
Laura Gunderson, Director of Public Interest and Accountability.
Amy Wong, I'm the Newsletters and Special Projects Editor, and I'm at my home in Southwest Portland.
Okay, great. And I think what we'll probably just do is start off by going in alphabetical order with the candidates, each kind of giving us a 1 or 2 minute introduction about who you are and why you're running. And if we can start with Senator Atkinson.
Thank you. Yeah, my name's Jason Atkinson. I am very excited to be running in this race. I am originally from Ashland, Oregon. I put myself through college, fell in love with a girl who put herself through college too, through OIT, and then together we put myself through graduate school. I was raised in a family of broadcasters and of public servants, and in agriculture, which is a whole nother big part of my life. When I finished graduate school, I was very idealistic about public service and very used to being broke. And so there was a guy, Eldon Johnson, who was a state representative and had been for 24 years. I was 26 years old, and I decided I was already used to it, run for office. And I had just started my first company then, and just come off of another career that actually I was in professional sports for a few years. And so I went for it. And at that time, all the newspapers were against me. All the lobbyists were against me. And all I had was my work ethic. And suffice it to say, I ran, won, and then served 14 years in the legislature. And I was very proud of my service. During the course of that time, I kept my businesses going and started working in the Middle East. So I think I sent on some of my earlier backgrounds to all of you. And joined the Aspen Rodell Center in Public Leadership, which was just responding on just a moment ago, which I'm still very proud of. I took a break from all of it to get my son through high school and to work on a project out of politics that has consumed me for a big part of my life. And that culminated in a film called A River Between Us, which I'm very proud of. And went back to work. I've got several projects that I've worked on, many of which the Oregonian has reported on. I've continued to do work in the Middle East. We put up hospitals for refugees in the Middle East on the Syrian-Jordanian border. And I have been working in finance and working in film, and looking forward to an opportunity, as I said, to return to public service, because that's really my passion in life. And in this race, we've done a terrific job, and I'm very excited. I know that's exceeded my 2 minutes, so that's my background statement for you.
Great, thank you. And Senator Bentz.
Thank you for this opportunity. The background you folks are familiar with because we sent it in to you, but briefly, my family came to Eastern Oregon 100 years ago. Granddad came up from Texas and went to work on a ranch down near what is now French Glen. And then he stayed when Swift Meatpacking that owned the ranch went back to Chicago. And he had a bunch of little ranches, and he traded them for bigger ranches. And then eventually I ended up up near Druzy, not a very big town, it's very close to Ventura, another not very big town, and some 50 miles from Burns. I realized early, I was one of 7 kids, that education was extremely important. My family was hugely interested in us reading. I don't think we had TV there until the mid-70s. So we spent all our time reading, and I realized it was really a good idea to get some sort of education in the law. And I worked my way through college at Grand, and then through law school, and then came back here to this very building about some 35, 40 years ago. I've spent my time over the first 30 years of my law practice representing individuals all across Eastern Oregon, a little bit of Western Idaho. The focus of my work has been on farms, ranches, rebuilding, restructuring, banking, and in general, trying to keep businesses going in this incredibly marginal space. Did a lot of work with timber and loggers. Also, my family's been heavily involved in the wood industry. The reason I want, well, during that entire period of time, I was on the school board, I was on the St. Peter School Board, I was on Project Dove, Domestic Violence Eliminated Board here in Ontario. There are any number of other interest groups. So water has been a specialty of mine in the law and other in my just interest. So my family is scattered all across Eastern Oregon. I have, I think of the 20 counties, I have family members in 6 of them. And so my reason for wanting to go back to DC is to try to help not only my family, but my previous constituents before I got out of the Senate. And of course, all of the wonderful people in this great district. So I'm happy for this opportunity to share the opportunities that I think all of us understand exist in rural Oregon. I want to mention one other thing. When I went to Salem 12 years ago, I went with an enormous chip on my shoulder. And here's why. It's that people will come out of the urban area and assume that if we are still in this rural space, we're not smart enough to get out. And that would not be true. We're here because we think this space is great and it can be even better. And so I've made a point when people would come before my committee of making sure they understood that Eastern Oregon was to be respected. And that's one of my reasons for wanting to go back to DC.
Thank you. Representative Buehler.
Yeah, thank you. Thanks for having us all this afternoon. It's a wonderful opportunity to be able to spend some time talking about these issues. This race has started off really fun and wonderful for me, being able to travel the district. It's such a big, beautiful, and diverse district, meeting all kinds of people like I did governor's race. And what I'm hearing over and over again is that folks are angry and frustrated, having their voices and values disregarded and disrespected to a certain extent. People feel like their way of life, their communities, their jobs are increasingly threatened by the big arm of government. I heard that also during the governor's race. It's consistent in what I call the other Oregon, the Oregon outside of the Willamette value. So I'm running for really a straightforward reason: to stand up and fight for the people and places that I've called home for over two decades, to be that voice for people who all too often, in my opinion, have been silenced and left behind to a certain extent by very powerful forces in Portland, Salem, and in Washington, D.C. I have deep roots to this district. Like Cliff and Jason, we're all products of rural Oregon. I grew up in Roseburg, one of 3 sons, a butcher and homemaker, 2 people who didn't graduate from high school, so they stressed to us the importance of working hard, playing by the rules, and getting a really good education. I took them seriously with that and went to what I think is the best university in the entire nation, Oregon State University. Played a little baseball there, and then on to medical school, where I met my wife, Patty. At graduation, I asked Patty 2 real important questions. 1, would you marry me? And 2, would you return to Oregon and make Oregon our home? Fortunately for me, she said yes to both of those things, and we've been partners in everything we've done for almost 30 decades, be it raising kids, growing our medical practices, starting businesses together, and certainly my political career in this run for Congress. As you know, I served 2 terms in the Oregon legislature representing Bend. That was a wonderful experience. And then my run for governor in 2018. What originally started my political career really was when I was managing partner of our medical group. I was an orthopedic surgeon, but also a managing partner of a large medical group that now employs over 300 people. And Patty got tired of hearing me complain about all the rules, regulations, audits, and inspections, taxes, and she said, "One evening, either you have to quit complaining about things, or you need to do something about it." I think she probably wishes she wouldn't have said that now. But 6 years later, now running for Congress, and very excited about the opportunity. I do think rural Oregon, the other.
Can you all hear me?
Yep.
Okay,
Yep.
great. Thank you. Great. So let's see. Let's move on to questions. Our first question. And Senator Bentz, if you wouldn't mind starting off with this. Congress recently passed a $2+ trillion relief package that includes money for increased unemployment insurance benefits, $1,200 checks for millions of families, and a low-interest loan program intended for small businesses that has unfortunately already run out and been used by a number of larger businesses that some question whether it was really intended to serve. What steps, if any, should Congress take next to help Oregonians and others across the country get through this economic crisis?
Well, of course, the most important thing is to get Oregon reopened. That's the most important thing, and the focus should be on how to get people back to work and back in their businesses, and making sure that our economy gets up and running again. Because I support getting money from the federal government out to everybody. Yes, I would have voted for the $2 trillion. Yes, I would have objected to part of it, I am sure. But the bigger issue, we're never going to have enough federal money to plug the hole, the crater that's now in our economy, never. And it'll be done imprecisely, incorrectly, and at the end of the day, necessary. But the better thing to do is get back out there as quickly as we can. And so what I would be doing is saying, let's do everything in our power to try to get people back to work. If that means more testing, that means helping people structure ways to get back, then let's do it. As far as a second package, of course, so many small businesses are left out. I really can't count them. But that simply illustrates the need to get the United States open for business again. And I want to compliment everybody for working so hard in this shutdown, because it actually has worked. Thank goodness. So now the question becomes, how can we emerge from that space carefully, but not any more slowly than absolutely necessary?
Great, thank you. Let's see, Representative Buehler, if you could also answer that question. Would you like me to repeat it?
Yeah, I had.
Okay, sure. No problem. Congress recently passed a $2 trillion relief package that includes money for increased unemployment insurance benefits, $1,200 checks for millions of families, and a low-interest loan program intended for small businesses, but that has already run out of cash. What other steps, if any, should Congress take to help Oregonians and others across the country get through this economic crisis?
Yeah, I certainly approve the CARES package that was passed. I think that the combination of payments directly to individuals, the grants to businesses, especially if they maintain unemployment, and the EIDL loan program that was especially helpful for very small businesses with a near immediate $10,000 grant, if needed, was very thoughtful. It does look like, I agree with Cliff, that there needs to be another tranche of funding. I've heard lots of small business owners who filled out the application correctly and early have not been funded, and certainly needs to be forthcoming. You know, we sustained a big demand shock to the economy, primarily because of healthcare reasons. So with the economics and the healthcare of this are intertwined and related. You know, we can keep on feeding the economy, but the real solution here to getting people back to work is solving the health challenges that the coronavirus places on us. So I think that needs to be addressed. That needs to be addressed with a very robust public health response. Unfortunately, we've underinvested in public health for a long time, not only as a state, but as a nation. Before we can put people back to work, we need to be able to trend the data. We need to have good data out there. Thanks for you all drawing attention to that. I've been corresponding occasionally with Pat Allen, trying to get him to release daily census numbers, because that's really, in my opinion, the best way to track. And tracking and trending this data is going to be the first step to getting people back to work. Then we have to be able to test adequately. We have to treat people, have the capacity of our hospitals in terms of personnel and equipment. Then we have to have tracing capabilities. And then we have to understand that, and we have to communicate with our citizens and the public that this is not going to be a light switch. We're going to probably have to toggle back and forth between different states of social engagement for at least a year until we have enough herd immunity and hopefully a vaccine to get people safely back to their regular lifestyle. So the economic policy, I think, has been solid, but it needs another tranche of funding, but it also needs to be paired with a more robust and thoughtful public health response.
Great, thank you. And Senator Atkinson.
Thank you. I think I would agree. First of all, in the first tranche of funding that did come in, oh, now it's my technical issue. Now I can't. Oh, I'm being anti-zoomed.
We're still getting you all right.
Sorry, I had a phone call coming in. It disrupted my entire network. I agree that that the federal help that came through was much needed, and I completely, as my colleagues have said here, if I was presented with that, I would support it. I would support that vote. I think what we've learned from that first wave a month ago was a couple things. Number one, there hasn't been a clearinghouse of information of how do people actually plug in to get the money, especially on the business side. So I have been working with a couple of different folks, but the bottom line is the SBA website has been a good landing place for people to understand how to apply and if they can actually achieve the funds. But the rumor mill out there, somewhere between SBA and IRS, we still haven't seen a lockdown of where those funds are available and who can get them. So you have to have a clearinghouse. Number two, I think the states are going to have to dig deep. And Oregon is one of them, and we haven't had a special session because special sessions haven't been all that successful lately, but also because of the coronavirus. But I think everyone here would agree that we would have, as a state, need to increase the unemployment backfills that currently are probably going to run out in the next couple of months here in our own state. I think it's true. We're going to have this retimed. Typically, Congress will take the month of August off. And this year, with the backlog of work, I think Congress will not only come back in August, but there'll have to be a tranche then, and there very well will have to be a tranche at the end of the quarter, because there's a couple things at play. Not only is there the economy at play, but there's also the value of the dollar. This morning, crude oil went to under a dollar, and then it went negative for the first time in we don't know how many years. I don't know how many years. So you have the value of that dollar on a world market. And if you look at those economic conditions, I think you might see that Congress might have to have a third wave of funding or tranche shot into the economy. This is personal for me too. My wife applied for unemployment for the first time in her life. Her dental office, the dentist, there's two dentists, and those fellas went to work at Safeway in the bakery. So they went from cavities and root canal into working in a bakery because they have kids in college and they don't qualify for unemployment under Oregon rules. And yet that office gets together twice a week on a Zoom meeting trying to get back to work. My dad's company had got completely different advice on whether or not somebody through their HR company, if somebody should be furloughed versus laid off. And there's a difference between how SBA looks at those two words. And I think that confusion, if we've learned anything from this first tranche from the federal government, is the second tranche actually has to be able to work better for folks. Lastly, I'll say, and wrap up my answer, I believe very strongly that we have to allow local communities, county commissioners, even mayors make a decision of when we go back outside. It's entirely different that you face in Portland as to a place like Talent, Oregon, or a place like Jacksonville, or Klamath or Bly. I mean, those communities, everyone is trying to do their best, but since there's no agreement on what the news is, there's really no agreement on what the protocols are. And so it's an interesting social example, academic example, really, of the moral leadership that government has. And I think in this case, getting that back into local hands will probably get our economies, especially in rural Oregon, reopened quicker.
So just so I can I make sure I'm understanding, you're advocating that local officials would decide when to lift a stay-home order or what businesses can come online?
Yeah, I think that would make a lot more sense for Southern Oregon, for Eastern Oregon, than the current action that we have, which is what's Portland doing and should we apply it? It's really not working, and folks are getting very restless and ready to get back to work.
And so in terms of what role would public health officials' advice play in terms of whether local officials consider that or how deeply they consider that in making that decision?
Well, in most counties, county public health is part of the county decision-making matrix. So they're already county commissioners and public health is already tied together. So I think that question really does come down to county commissioners, but those roles, Jackson, Josephine, Klamath County, I can say with firsthand experience, they're all working very closely together now. So, for instance, we have Fauci on Fox, CNN, and MSNBC every day. In Southern Oregon and in Eastern Oregon, everyone's got to know their public health official.
Okay. That does work into my next question, and I believe Knute, you'll go first on this one.
Okay.
Nationally,
And I have to jump off for the news meeting. I'm sorry.
okay.
Thank
No
you,
problem.
candidates.
Yeah,
I have to too, but I will be back. So I will be back.
Great. So Knute,
I'm staying.
nationally and in Oregon, many are increasingly pushing back against the stay-home order and calling for a reopening of businesses. Over the weekend, hundreds of Oregonians gathered in Redmond to protest the governor's order and challenge social distancing guidelines. What is your position on how to balance these economic and health interests, and how soon do you anticipate that Oregon, or would you take a position in terms of Oregon reopening for business?
Yeah, that seems to be the question on everyone's mind as we all grow restless and develop cabin fever with the stay-at-home order. I think it's too early. From my medical experience, the plan that was released by President Trump in the White House at the end of last week was particularly thoughtful and very prescriptive. I'm glad to see that the governor looks like she has embraced that plan, at least by her latest communication about this, meaning that we need to go in stages and it needs to be data driven. So my message to the folks in Redmond this weekend was be patient. Protesting and breaking social distancing guidelines is not wise right now. It's not wise for your health. It's not wise for the people around you. But it is wise to push and ask, how long is long enough? I personally think as long as we see the trend data continue, that 2 full incubation periods which would be at the last week of April, and gives us a few days more than that, as long as we continue to see the trend lines decreasing. And that's what was in the White House plan to enter the first stage, where we start to allow some more businesses to come online, as long as we have the appropriate public health infrastructure around that exit plan. Meaning, like I outlined in my earlier question, we need to have the trending of the data, we need to be able to test, we need to be able to treat, we need to be able to trace cases, and then we need to make sure everyone's aware that we may have to toggle back and forth between different levels of social isolation. We do need to probably start in those counties that have had few, if any, cases. I differ with Jason. I do think that needs to be in cooperation, in an alignment between the state and county government. A lot of these county governments in areas that I would like to see open first will need some resources from the state, rapid testing, access to PPE, and those types of things. But there's clear counties, I say a county like Lake County that has had no documented cases. They have a sophisticated rural medical community. They're used to social isolation. It's one of the least populated counties in the state. They have a rapid testing machine already placed in Lake County. So to start, entering a staged withdrawal from stay at home in a place like Lake County and then spreading it slowly to those other counties, I think would be a good approach. And I think we're ready to start that if the state, if the governor can adequately maintain public health resources at the end of April.
Great, thank you. Let's see. And Cliff, would you like me to repeat the question?
No, I think the question was how to get everybody back to work safely. I think that's the question.
Right, and also just if there's anything that you would do in terms of a message to the people who gathered in Redmond challenging the order.
Well, I would say to them, they're going to challenge the order, at least maintain your distance. It's no surprise that they're challenging the order. Some of the inequities that are so obvious just are really sad. I mean, you go out here and stand in line in front of Walmart and Home Depot to get in, or even hesitate to say it, but the various marijuana shops here have lines going around them here in Ontario because of all the people in Idaho coming over here to buy the product. Yet mom and pop grocery store is shut down. Mom and pop restaurant is shut down. Nobody can use, I mean, the unfairness of it is measurable. And so that needs to be fixed. And that's what you see people doing, is rising up and saying, this is ridiculous. It's not fair that these rich are getting richer and the poor. This is wrong, and something needs to be done about it. And I don't fault those in the healthcare business for taking the safe approach, because that's their job. Where I think, I'm sure all of you read the article in the Wall Street Journal called "Moving the Goalposts." If not, in the editorial pages, I would strongly recommend it if you haven't, where the author points out that the original concept underlying the shutdown was to delay the virus, not eradicate it. And what's happened now is there's been a shift. And if we don't keep everybody from getting ill, somehow there's been a failure that is being perpetrated by the Democrats in DC, which is unfortunate. What we should be focusing upon is how we can balance this virus, which is not going to go away soon enough to save the economy, against the need to get reopened. And this does not fit in precise spaces. As Knute well knows, the medicine is not a precise thing. It's challenging and difficult. But on the other hand, these people that showed up in Redmond are many of them, I'm guessing, were my constituents in the Senate, and they are justified in being impatient with our governor not stepping up and saying, look, there are places where we can, if we do all the stuff that's supposed to be done, whether it's wearing masks in stores, sanitation thing, maintain the distance. I want to mention one other thing about the local part, and it goes to the coordination. We're right here on the border. So whatever we do in Ontario Are they going to do it in Boise, Idaho? We're not going to close the border. And the same would be true in Lake County. They're not going to shut off all the people coming up out of California or those coming down and going through town. So that coordination piece, very challenging. And those kinds of things need to be addressed. But at the end of the day, there needs to be a focus on the fact that the federal government cannot fix this by pouring money in, don't have enough money, first of all, and it's imprecise second. So I would encourage our governor to do something more rapidly than wait the 12 days. She wants to wait with no cases. That's imposing a burden that's too great.
Great, thank you. And Jason, would you like me to repeat the question, or?
Yeah, I think so.
Okay, sure. Nationally and in Oregon, many are increasingly pushing back against the stay-home order and calling for a reopening of businesses. Over the weekend, hundreds of Oregonians gathered in Redmond to protest the governor's order and challenge social distancing guidelines. What's your position on how to balance these economic and health interests?
Thank you. Well, I don't support the protest simply because breaking the protocols and endangering somebody else's life. I think that's the absolute wrong approach. I think the balance is earlier what I said in my question. I do believe that counties are going to be capable of making a decision that allows people and businesses to get back to work. So right out the window here is a very, very small town that 30%, I was talking to the chief of police yesterday, 30% of the businesses are estimated not to come back. They'll be gone, they'll be lost. That's a problem. I think the inequity issue was brought up. We have, for instance, Central Equipment, a place that services tractors. Actually, mine was in there. That's how I know this. They're open as essential, but yet almost every restaurant is out if they're unable to do takeout. We've got a bigger problem here than I think we're really addressing, and one size fits all really doesn't work. Let me give you one other quick example. In our office here, it's a long story of a connection, but an old friend of mine who has worked in the military for a number of years in various branches of federal agencies is able to get masks by the millions, face masks. And our office here has put campaigning on a hold when this came to us. And we've been trying to plug in that availability of masks into the state of Oregon, and we couldn't get through. We tried to plug them into regional healthcare like Asante, Providence. We couldn't get them. We've been trying to connect them now that we've got a little bit of say, Oregon does, in reopening the country, the federal government. And somewhere between the amass of government, here I've got a solution to a known problem, and I can't get any coordination. So again, like Senator Bentz says, I don't think it's time to point fingers at all. It's back to, we've learned some lessons. One of the lessons is people need to work. Two is, as I said online recently, people in Oregon especially want to go outside. They need to be able to go back outside. This isn't New York City. Southern Oregon, every park is shut down. Now, I don't know about you, but when we go as Oregonians, there's a part of us in our DNA that's about social distancing. I was talking to an OPB reporter at Bend who I said, "Where are you from?" She said, "I'm originally from Austin." And so I got into a very long conversation with her about why I'm sure she chose to live in Bend. It's because we live outside. That's who we are. But in Southern Oregon, all the boat ramps are closed. All the parks are closed. People are being told to stay inside for a problem that, we haven't really, fortunately, and I think this is a good thing, haven't seen. I think it's time to get people back to work.
Okay, great, thank you.
Helen, can I mention one thing?
Sure.
This is something that we all need to consider. But when the governor issued the order, that established a standard, and if it's violated, there is a good chance that would make whoever violates it liable in tort for damages. And that means if someone chooses to step outside the boundaries established by the governor's order, you do so risking A, a lawsuit, and B, losing your insurance coverage. So one of the things that would be great for the governor to do is to tell everybody exactly where they stand from a liability standpoint by virtue of the issuance of her order. I don't have time to research it, but she could easily have someone do it and say, hey, this is, you decide you want to open your restaurant and someone gets sick and then they can sue you and you don't have the insurance coverage. So someone needs to step up because that issue has to be addressed before people get too carried away about what they're going to do in opposition to the governor. So at least they do know the additional risk they might be taking by stepping out. And then one other remark, I was talking to one of my good friends down near Jordan Valley, and he indicates that people by the hundreds are coming out of Idaho and into the big space of southeastern Oregon. They can't get into the parks, so they're parking up and down the roads. And he was talking about the road from where his ranch is. He counted 60 vehicles parked along the road. Can't go into the park, but they're all there. So, so these are kind of a reflection of what's going to happen if this situation isn't managed just about as well as we possibly can.
Thank you.
Yeah, let me just add it to, because Cliff makes a good legal argument for, for quashing the protest. But I think a leadership from the governor where there was clear plan that was communicated to people with real metrics and expectations, and then at least a targeted date that people could start going back to work would go a lot to quell some of the emotions that are coming from the protesters. And I think that that is a leadership issue that we've seen throughout this whole month of not communicating clearly with regards to these issues, expectations, and what the plan is.
Okay, I'd like to move on to the next question, and we don't have a whole lot of time left, so I'm going to encourage you to be really mindful of your answers. The next question is about the shortage of coronavirus tests. At the same time, and some of you have noted this, widespread testing is a key requirement for businesses to safely open. There's been this ongoing argument between the federal government and states about who shoulders the responsibility for securing these tests. Who, in your view, does have that responsibility? And if you were in Congress now, for instance, what measures would you support or do to help increase the supply? And this goes first to, I think, Knute.
Okay. It's a very important question because testing is really a foundational element to getting us back to somewhat more normal life. It's not really safe to do it without increased testing capability, both testing to see if people are actively infected or if they have the antibody and have previously been infected and thus are not a risk of getting ill themselves or passing it on once again to someone else. I think it's a role of the federal government to make sure coordinating the market with regards to the testing capability to provide the necessary infrastructure, access to reagents and other inputs to making the complete test kit. That is unfortunately something that has been lacking, but it's also been a problem at the state level, whereas we see in Oregon, we have tens of thousands. We're not quite sure how many test kits are sitting in Oregon unused, and there's not a clear protocol and process that's been implemented in Oregon to use that testing capability. So, to me, there's been failures at lots of levels of government, stretching all the way from the World Health Organizations to the CDC's early miscues with regards to their tests that had a high false negative rate, all the way down to states that have not adequately engaged and used the testing. This is something that when we do the review, the quality improvement with regards to this response needs really some improved effort with regards to how we not only procure tests, but all kinds of medical equipment.
Great, thank you. Jason.
To answer the question succinctly, I believe that federal government should hold that responsibility. I believe that the testing needs to come into that same role of government that we have on a couple of things in the United States. K through 12 education. We don't single out, at least we fight on that in politics all the time, but the federal policy is that an urban kid is treated the same as a rural kid is treated the same as a suburban kid, and dollars are supposed to follow that way. Rural electrification, if the federal government didn't step in and create a policy of rural electrification, cities would have power and rural communities would not. So I think if you look at the policy of it, I think the policy should be that the federal government should provide each American the ability to get tested. That being said, the other component of it that is to me is a bit of a barometer of effectiveness, whether or not the federal government on this works or not. And this isn't a good barometer in today's standards. But if you look at the federal VA system, so the VA is administered by the federal government and it's supposed to be administered broadly across the United States. In the 2nd Congressional District, that is a major issue. So you look in Central Oregon, you look in Medford, you look in LeGrand, Pendleton, and certainly in Klamath Falls. So per capita, that veterans issues are bigger here, and yet the state's biggest veteran facility is right next to Oregon Health Science University. So one of the things that we fought for years in the legislature, and I give you many examples, but was trying to get services that were due somebody through the federal government, when those dollars hit the city, make sure that they got out to where they're supposed to be. So that being said, I think the federal government should be the clearinghouse. Number 2, there should not be any strings attached, meaning you'll get your test kit if this piece of policy comes in. I think there should be no political strings attached to getting kits disseminated to every American. And number 3, I think the Attorney General, federal Attorney General, in conjunction with our state's attorneys general, should make sure there's no price gouging. Again, I go back to this the medical mask example that I was even working on last night. The federal government is willing to pay 3x to what one Oregon vendor has to offer, and that Oregon vendor can't find a way to get the federal government to pay attention. I don't point the fingers as a systematic failure. I think this is a growth pain. Certainly in all of our lifetimes, this is the epidemic that we heard about, from 110 years ago. No one on this phone call or Zoom call has lived through this. Government was not ready for it. So the example is, how do you put systems in place to make sure that every American is tested going forward? And my answer is that burden falls on the federal government.
Okay, thank you. And Cliff, would you like me to repeat the question?
No, thank you. The very short answer, the federal government's going to have to pay for it because the states aren't going to be able to afford it. I think everybody is trembling in their shoes as they anticipate the May revenue forecast here in Oregon. However, waiting for the federal government to act is going to make everybody that's impatient now even more so. We have OHSU here. I know there are private businesses already working with OHSU to obtain their approval of test kits that they've imported from various places. So the question is, how do we harness the power and alacrity, not alacrity, but the flexibility of our private industry to have them put this testing protocol in place. The problem we have, as you know, is this requires coordination among states as people zoom back and forth across borders, and you kind of want to have the same protocol in each state. And that's generally, I think that's why you see our governor working with other governors. to try to figure out how to coordinate. So I just hate to, the federal government's got to pay for it, but at the end of the day, I'm hopeful that the state will take a more aggressive part in it and harness the power of our private industry to do.
Great, thank you. Let's see, the next question goes to Jason, and I believe Amy has one on that she'd like to ask.
Yes, thank you. Repealing the Affordable Care Act has long been a Republican goal, and Representative Greg Walden helped lead a 2017 effort that ultimately failed. But the coronavirus pandemic is highlighting concerns about healthcare access and costs as millions of Americans face both layoffs and loss of their employer-provided health insurance. So would you support rolling back the Affordable Care Act? And if so, what would you propose replacing it with?
That's a great question. I think your question is even better placed about 2 months ago, because then, as you said in your question, the coronavirus hadn't hit. I think all bets are off going for the next Congress in 2021. The healthcare system doesn't work. I have got a long track record of standing up against insurance companies, and I actually wanted to interrupt Helen and agree with Cliff. And I'll give you a quick story to answer your question. In about 2004, 5, and 6, with Ted Kulongoski, and then later with John Kitzhofer, we worked on this bill to allow telehealth through Oregon Health Sciences. Cliff, thank you for that. To make sure that rural healthcare was provided from our best in Portland. And what happened was all the insurance companies fought us. They didn't want to pay for mental health. They didn't want to pay for services that weren't, billable by the model. We fought. We eventually got it. Johns Hopkins picked up the Oregon Health Science Protocol, and now, looking forward, and nobody knew this, but looking forward, the national standard for telemedicine comes from Oregon, which is really, hopefully that comment will have you as the Oregonian dig deeper and write a story about that, because it's quite an Oregon success story. And we did that in the face of a healthcare system that didn't work. The Affordable Care Act drove up my company's medical practices or healthcare insurance premiums. In fact, most of the companies that I'm either friends with or have worked with, their health insurance went up and their service went down. So in my case, I have a little family. My wife has had cancer. My son has had cancer, and my son was born at 24 weeks, and I've had some health problems. So we're a small family, but we're also very, very experienced in fighting healthcare, health insurance companies. And for what I pay for the three of us under the Affordable Care Act is it's about 30% more, and I get less coverage for it. The system didn't work. I think there are some very creative ideas out there that I'm interested in, and Amy, I'm not going to tell you something as a candidate without fully having thought it through. But what the things I'm interested in are, number one, the ability for people to keep their health care and certainly be able to go in and out of programs to find their right doctors. I think medical choice is absolutely key. Number two is I think that the insurance companies are not part of the solution at all on healthcare. Insurance companies make money by not paying, not by paying. I was just on a case.
And I'm sorry, if you can just kind of start to wrap this up a little bit more.
Well, Helen, I'm just getting into it. Anyway, I'm getting this. I don't know if you can see my from. I would work on supporting or removing Affordable Care Act, but I really think that's the wrong question. I think coronavirus has healthcare for the first time before the United States, hopefully in a nonpartisan way, to assess all the holes we have in it in 2021.
Great, thank you. And Cliff, if you wouldn't mind going next, would you like me to repeat the question?
No, I would vote to repeal the Affordable Health Care Act, or Obamacare as it's referred to as, and I would work to replace it with something that did recognize and protect pre-existing conditions, and of course I would do whatever I could to help reduce costs. I don't pretend to have the solution to a $3 trillion, now even more, system. Buehler has a much better grasp of this than I. So I would just say I would vote to repeal, and I would make sure that pre-existing conditions were covered, and I would do my best to try to reduce costs. I blame a big chunk of our, higher cost healthcare system on Knute because of his excellent job as a surgeon. And if he wasn't so good at replacing knees and hips, perhaps the cost would be. The truth of it is, doctors such as Knute have done really astounding things, and everybody wants a new hip, everybody wants a new knee, everybody wants a new shoulder. Who can blame us? But figuring out how to pay for it is another question. We need to do a better job.
Okay, thank you. And Knute.
Yeah. Well, I've never been a big fan of the Affordable Care Act. I've said from the very beginning that is like pouring gasoline on a raging fire, and that fire is the growing inaffordability of healthcare in the United States. Health insurance, be it prescription drugs, nicely outlined by Jason, and he's had a lot of personal experience. Speaks eloquently about that. It had some good things, the coverage of pre-existing conditions, extending insurance to age 26, I think has been beneficial. But at the end of the day, it just expanded access to Medicaid for a lot of people and opened up the private insurance market to individuals, both of which were done without adequate cost control. And we see these very big cost escalations every year, and needed to be a lot more focused on reforming the delivery, right? The system is incentivized for volume and not value, and that was a key mistake that the Obama administration missed. We need to go back and re-kilter the incentives in the healthcare system. Incentives should be keeping people healthy, not paying for disease. And until that's done, we're going to have continued problems paying for healthcare and continuing to squeeze families like Jason's and many others.
Great, thank you. I want to see if any of the other board members have any questions they want to ask.
I do. I'm just worried about the time, Helen. What do you think?
Sure, let's just, is a few more minutes okay with everyone?
Sure.
All right.
Okay, I have one question that takes us back a bit of time to 2016 when the Bundys had taken over the Malheur National Wildlife Refuge and for many laid bare our two Oregons. At that time, Congressman Greg Walden took to the U.S. House floor in an emotional plea defending his rural constituents and criticizing the federal government. He talked about the government's poor stewardship and failures to protect his constituents' lands from wildfire. And he asked his fellow lawmakers to listen to the voices of people from all walks of life and understand why rural residents felt so oppressed. What do you think about the tack that Walden took? Was he correct to say what he said at the time? And what would you say in the same position today? And Helen, I'll rely on you. Was it
I think Cliff is next.
Cliff, sorry.
Right. Well, I support completely what Greg Walden said. I wish I could be as articulate as he was in his remarks. He captured the situation extraordinarily well, and I think I mentioned earlier my grandfather actually came to that refuge, that exact spot, 102 years ago, and that's because the refuge is the site of the old Swift Meat Packing Company's location, and they bought it and turned from the Glen estate of French Glen fame. But the point is, people in this space view the federal government as overreaching and tone deaf, completely tone deaf. Now that has started to change as President Trump has taken over and changed the people who are leading some of these agencies. They are actually starting to listen. And I actually hear people saying that they've seen people from the Bureau of Land Management and they've seen people from the leadership of the Forest Service actually coming out and asking what they can do to help. And this has been a huge and welcome change. And I can only hope that the president is reelected and we can continue to see that kind of progression of help for people who are out there on the land trying to beat back the fires. By the way, one of the big things that's overlooked when it comes to ranchers is the attempt to put out fire. Now, the Hammonds were ultimately prosecuted for starting a backfire. And what Greg was trying to say is, hey, this the penalty dramatically outweighed the nature of the crime. Now, it happened that it was a minimum sentence that was imposed, but he was explaining why it didn't fit. But in the broader sense of things, what we need is more listening at the federal level, particularly at the bureaucratic level, to the folks that actually live out here.
Great. And I think Knute goes next.
Yeah, Laura, I thought Congressman Walden's speech with regards to the Hammonds was probably the best speech I've ever seen him deliver. It really, in I think 10, 15 minutes, really adequately and powerfully summarized the disenfranchisement of people in rural Oregon. And what I said when I started this Zoom meeting, you know, people feel increasingly disrespected and disregarded with their views and values and way of life threatened by a overzealous federal government that doesn't pay enough attention to them. And I know the Hammonds. I've known them for years. I for over 10 years did clinic in Burns. They're good people. They're not terrorists, and the penalty did shock the conscience of good people, and it should have been thrown out. And I praised President Trump when he pardoned the Hammonds. That was right in the middle of my governor's race, and I think it certainly shocked a lot of the media who was covering the race. But it's clear when you spend time in these other parts of Oregon that people's way of life, their jobs, their communities feel increasingly threatened by the heavy hand of government. Until Donald Trump was president, they felt increasingly isolated. And I think myself and a lot of people underestimated until Trump got into office the need to really challenge and overthrow the status quo with regards to a lot of federal issues, and the management of federal lands is just one of many, a very important issue to the 2nd Congressional District, that's for sure.
Thank you. And Jason, if you can round it out.
Sure. To answer the question about Congressman Walden's speech, yes, I support his speech. Yes, I thought he did a fantastic job. And yes, I would do hopefully the same thing. I think the nuance of the speech that I would like to answer with is that one of the things he was able to do, and I think the important part of that speech was the separation between the behavior at the Malheur and the realities of living in Burns and in rural Oregon. Oregon, over half of the state of Oregon is owned by the federal government. And this has been a topic that has always kind of been under the surface, but it really got started back in the late 1980s and early 1990s when a Nevada county commissioner in Nye County, Nevada, put a big D8 in front of a federal BLM road and said, show me in the Constitution that you can make me move this tractor. And that turned into a case which turned into the Nevada land plan that swept, and parts of it got caught up into some extreme politics, and some of it got caught up to, I'm sure, as Senator Bentz would say, into some fascinating areas of the law. But the reality is that in many of the counties in the 2nd Congressional District, the percentage of ownership of the federal government is a lot higher than it is statewide. So you've got states or counties in 60, 70, 80%, mid 80% owned by the federal government, who doesn't pay taxes, who has brand new trucks for workers to go to, and then largely is not seen when it comes down to issues. Here in Oregon, in Malheur, in Harney, in Lake counties, along with counties in Nevada, before Trump took over, it was the sage grouse. And all of a sudden, the sage grouse came in, and time again, from Southern Oregon and certainly all the way through the Northwest, you have this perception that the federal government is more fascinated with a species than with a human body, with a human being, with a human community. And I think that has started to turn around. I think the anger that people feel is a real thing and is part of the job. Look, being a congressman, let's face it, 85% of this job is constituent service. It is how well do you do serving people. It's not answers like all three of us are giving you here. It's actually, do you get your hands dirty and help somebody who's fighting the federal government to get water on a piece of ground? In the case of the Bundys, if you look at these people didn't pay their grazing fees. I don't know if you know that part of the story, but these people never paid their contract with the federal government, and then with their pocket constitution said, well, we don't have to. And now, a couple of weeks ago, one of these actors who was in Burns and then in jail in Portland is now outside of Boise trying to prove this point again, that the federal government has overreached. I think whoever is the member of Congress, I think we as Oregonians have to separate those bad actors from the fact that there's real issues facing folks in rural counties that feel that the government is so big that they can't listen to them. We fought for years and years and years and years to keep the tanker base in Medford. That's what fights fires from Lake Klamath, Josephine, Curry, and then all of Siskiyou and Humboldt and Modoc counties. All of it's from here. And for years, the fact that we had to fight the federal government to keep the tanker base here was something that rural people the commonsensical nature of how that works and looking at the map and where the airplanes go and the forests don't have roads, to us it made sense. But the fact that we had to fight it was aggravating. If you go back to the spotted owl days, it appeared that the federal government was choosing a species over a community. People still haven't healed. I think the job of a congressman is to do the very best constituent service that you can. And it's also to work for people as they fight with their federal government. And it's also to work with the federal government to restore that trust. It's a very delicate job. And walking that fine line, I think, is what Walden did the best.
Great, thank you very much.
Thank you.
We've gone through the hour plus change really quickly. I appreciate all the extra time. And while we were only able to hit on a fraction of our questions, the questionnaires you sent in will also really help inform our decision. But thank you very much, everyone, for being with us today. We'll be coming out with our endorsement toward the end of the month or beginning of May. So thank you very much.
Thank you, John.
Thank
please
you.
Turn in that machine. I'll be up right over.
Thank you so much.
I'm looking forward to it.
Thank you.
Thanks, everybody.
Thank you. Bye-bye.
Bye.
Bye.